being here. Just note that this meeting is being recorded. You will receive all of the resources from today in a follow-up email along with the recording. So we'll share that out with you. Anything that is added into the chat as a resource will be shared with you. But without further ado, I would love to hand it over to Dr. Frederica Brooks Davis for some introductions.
All right. Good afternoon, everyone. And I want to thank Ms. Jackie Zimmerman for opening us up today and for all of her assistance that she is providing in technical support behind the scenes. I do want to, at this time, give a disclaimer that the information that we share is for educational purposes only. So while we may be mental health professionals, a pastor, an attorney on for our webinar today, that we want you to be clear that this is not for your specific situation. We are not offering any professional mental health or legal advice, but this is a book discussion, and we're going to do so. And we invite you to, as Jackie said, provide any questions in the chat. I will also note that we thank those who sent questions in advance. We have received those, and we are going to start with those questions. But if you didn't have an opportunity to submit questions in advance, no worries. We're going to do our best to answer your questions as well. So let me first start and thank my colleagues for joining me here today. I also would like to mention that this is being hosted by one of the committees of Mental Health America, and that is our anti-racism ARIES committee, which was led and started during the COVID pandemic after George Floyd, Ahmaud Arbery. And so as a result of that, we are fortunate to have with us our founding chair, who's now a member of that committee, Courtney Lane. I'm going to start us off down in North Charleston, South Carolina, by introducing Pastor Byron L. Benson. He is the senior pastor of the Mount Moriah Missionary Baptist Church down in North Charleston. A very growing congregation, serves in a number of capacities down in Charleston, and he is also an advisor to many groups. We have a podcast together, a pastor and a therapist. I've known Pastor Benson for a long time. He's also in the mental health space and has training there in head and heart in terms of mental health, specifically working with families and couples. He is a husband there and a father of 3 beautiful daughters. And so we want to welcome Pastor Benton to our MHA space today. Then I go over to attorney Courtney Lang, who is the principal, and also she is the founder of Lang Co. and Partners, which is a public affairs firm recognized for mobilizing constituencies to achieve impactful business goals aligned with equity in healthcare and public policy. She is a strategic communications and health justice expert whose primary purpose is advocacy and activism and grassroots mobilization. As I mentioned before, she is the founding chair and also serves as a member of the ARIES Committee of MHA, but she also serves there on MHA Board of Directors. So we want to welcome Ms. Courtney Lane to our discussion today. And then I'm Dr. Frederica Brooks Davis. I serve on the ARIES Committee along with Ms. Lane, and it was through our partnership and the committee's approval that we are bringing this opportunity to further highlight the work of Bebe Moore Campbell. And so with no further ado, what I'd like to do at this point is we're going to now move into hearing from Bebe Moore Campbell in her own words more about 72-hour hold. Followed from that, we'll begin answering some of the questions that we received in advance. So now, Jackie, if you turn your attention to the screen, we're going to see this video.
Writers are supposed to write what they know. And I know about mental illness. I have a mentally ill family member. And I saw the illness begin to be manifested about between 8 and 9 years ago. And at that point, I was shut down completely, went right into denial, and allowed stigma to overwhelm me. I was ashamed, embarrassed. I didn't want to talk about it. I forbid anybody in the house to talk about it outside of the house. It was my deep, dark secret, except when you have a mentally ill family member, They won't keep your secret. So the behavior was broadcasting problem, problem, problem. But within the household, we were broadcasting denial, denial, denial. And I went down this road for about 3 years until finally I connected with a woman who also had a mentally ill family member. And we formed a support group with some other women. And we met every couple weeks, basically to pray for our loved ones and for ourselves. And then we found out about the National Alliance for the Mentally Ill, which is an advocacy group, a 26-year-old advocacy group, 1,000 chapters across the country, advocating for those people with mental illnesses as well as the families. We took a 12-week course on the diseases of the brain, a free course that taught us about the illnesses our loved ones had, schizophrenia, a disease, a mental illness characterized by auditory hallucinations, bipolar disorder, also known as manic depressive illness, a disease of mood, fluctuations varying from flat-out depression to the highs of mania, mania being recklessness personified, violence, promiscuity, driving 100 miles an hour, rapid thoughts, not sleeping, speaking all the time, round the clock, shoplifting, and then depression, which can be the person who doesn't get out of bed and doesn't take a bath and doesn't eat or overeats. It can also be the person who's always angry. So we learned about the illnesses, learned and networked with each other, and then joined the support group, and then decided to form our own chapter in our own neighborhood, a predominantly African American community in Los Angeles. The reason being that while everyone, all colors, everyone is affected by stigma. No one wants to say, I'm not in control of my mind. No one wants to say, the person I love is not in control of his or her mind. But people of color really don't want to say it, because we already feel stigmatized by virtue of skin color or eye shape or accent, and we don't want any more reasons for anyone to say, you're not good enough. So we really go into denial. So it was very important that we open up NAMI Inglewood in that community so that people could begin to come out of the closet. And it's been very helpful. We've grown from 12 members to more than 100. We have been advocates for our relatives and for ourselves. And most of all, we have been stigma busters, because it is my belief that stigma is part of the reason, if not most of the reason, why people go into denial and choose not to get help for these diseases.
Thank you. And so we honor the life and legacy of Bebe Moore Campbell and the work that she's done through this work, but also her legacy lives on, July being Bebe Moore Campbell Month. And so now, on the end of Mental Health Illness Awareness Week, we are now going to discuss this more. And so I'm going to first start, for those who are just joining us, we welcome you to our webinar this afternoon. We're going to start with Pastor Byron. So we heard Bebe Moore Campbell refer to herself and this initial group that she started as Stigma Busters. We have someone to write in, and a question that they had, I'm going to provide two of those questions so that you can provide responses to those. Number one, how relevant is the book to the experience of Black folks in mental health and their loved ones today?
Thank you so much, Dr. Frederica, and to everyone, greetings. I believe the book is still incredibly relevant to people's experience, particularly when they have a family member who is diagnosed with a mental illness or is experiencing symptoms and signs of a mental illness. To kind of go back just for a moment, remember, for people of color in this country, there's already been this stigma of Black inferiority. And even when you go back to kind of the origins as the field of psychology really developed in the 20th century, it was caught up in the sciences that were just trying to prove Black inferiority. And so when you go back to a generation not too long ago, it wasn't just clinicians, it was any kind of medical doctor in general. People of color, Black folk, did not want to deal with, don't take me to, I remember my grandfather, don't take me to the hospital. They're going to kill me if I go there, right? So this is still incredibly relevant because when it comes to mental health, that's been behind even the physical health medical doctors. So it's incredibly relevant to people's journey. And the other thing I'll say to it to try and keep it short is we have a woman within our church who has been able to embrace and go on a journey who has been diagnosed bipolar. And her son, now we've given space for testimony. She's written a book, etc. And she talks about how had it not been for the church evolving to be a safe space for her to be able to really confront and accept that this did not have to define her, but that she did have to accept that this was a part of her journey, that she would not be where she is and be able to now minister in that space to others. So the book, in my opinion and from my experience, is incredibly relevant just as much now as it was in 2005 when it was written.
Thank you for that. And so in talking about mental health stigma and the African American community, what, if any, improvements have there been in the mental health treatment and stigma since the writing of this book?
Yeah. So where I would begin first there is I would say there's more Black clinicians, which is key. People do research on their own people,
Yeah.
and people should be doing research on their own people. So there's far more people of representation who are informed and have the knowledge base to speak into that space. Then that transcends, right? The hope is that that transcends academia, transcends where we learn and goes into the community, right? And so now you have more churches like our church that has a mental health ministry, right? We have 30 licensed clinicians who are there helping to inform us on how everything we do, from the intake of new members to how we give care to those when we go to visit them in the hospital, how we can identify. We have training to be able to identify when someone is suicidal, things of that nature. So what has happened is, and I could say much more, but due to time, I'll say the biggest shift has been there's representation now that we did not have before. Now there's still a deficit. We're nowhere near where we need to be, and we're projecting that deficit, right? APA has already come out saying that deficit's going to be even worse, and we need way more people of color who are trained and can speak into the space, especially as we get closer and closer to 2030. So again, just to recap that, the biggest shift has been there are more people who look like you and me, and even more pastors, right? My PhD is in marriage and family therapy, not in theology, right? Because of needing to get a deeper understanding, if I'm going to care well for the soul of other people, I need to be more learned myself on what that soul, which, if I'm preach for a moment, psyche in the Greek is the word soul. So that's a very important piece here, right? Where we get the word psychology, literally in the Greek, is the word psyche. So if we're going to deal with that well, right, more people of color have to be trained to speak into that space.
All right. And so when we talk about mental health, we left off with Bebe Moore Campbell talking about the stigma she experienced and we heard Pastor Byron talk about how we have made advances. I will also say, as someone who started a counseling center at a church here in Maryland, been in existence for 17 years. And so my degrees are in counseling and clinical psychology. And we have a training center. We are definitely seeking to bridge that gap and bring about more clinicians. However, we still have a huge deficit within our community, and stigma is still real. And so one of our goals, even within the area committee of MHA, is to bring about awareness of this stigma and to further extend the work that persons are doing in these spaces. And now on this call, we have a mental health professional, we have an attorney who fights against that and brings advocacy and voice, and we have a pastor. Right now, we are dispelling a lot of the stigma that has been in the community by these three representatives here on this space and time. And so we thank MHA for the space to do that. And so with that being said, let me go over to our advocacy, our legal person here with us. And I will ask one of the first questions that was asked. So for you, Courtney, what laws have changed to promote more support for those with chronic mental health issues since the transition of Bebe Moore Campbell?
Thank you so much, Dr. Brooks Davis. And I'd be remiss if I didn't hold up the book that we're talking about here today. This is the original version. I know it looks a little bit different, and I want to just give a little bit of honor and praise to my surrogate godfather, Ellis Gordon Jr., who made his transition recently to return to God. And so on behalf of the family, I want to say a deep bow of gratitude to them, to thank you and hold the space for Maya, Alicia, and Ellis III. So in response to your question, maybe just to ground the conversation a little bit, just to understand the 72-hour hold context, is that a 72-hour hold is not a federal mandate. 72-hour holds emerge out of the states. And in the context of the book, the setting in the book is fiction inspired by real life, but I just want to make sure that we're giving recognition that it's a fictional work of art, and it is a work of art, that a 5150 in California, or a 72-hour hold, is an opportunity. And I'm going to say an opportunity because it's important, for an observational period, so that there is stabilization of a loved one. And you heard Bebe Moore Campbell in her own words talk about the struggles with her loved one. It is the least restrictive means at the time should be enforced. And only a qualified officer or clinician can institute or evoke a 72-hour hold. At MHA, we support, and I think the link will be provided, we support dignity and autonomy. Always, first and foremost, we honor the person. However, when there is someone who may be at harm to self, or posing at risk of danger or threat to others, they may need a 72-hour hold to have that period of respite, treatment, stabilization. So I just wanted to make sure that we clarified that the laws may vary state by state, but the whole notion of a 72-hour hold is to serve as a protective factor for individuals who are in need of help. The laws are constructed that way. There is always autonomy. There is always autonomy, and we support enforcing personal autonomy to always preserve and protect the individual. And so I will pause on that, Dr. Brooks Davis.
Okay, so thank you for sharing that. And so I do want to say, because we know that persons have been joining us at different intervals, today we are talking about 72-hour hold. We did receive some questions in advance through registration. And so we're answering those questions, but we're going to have an opportunity to answer questions from you, our audience, today. You will notice that there is a Q&A box at the bottom of your screen that you can enter your questions there. We will be taking questions from the Q&A and not the chat. So if you do have a question, please move it over to the Q&A. It will be observed there, and we'll try to combine questions so that we can get to as many as possible. 72-Hour Hold, as it was mentioned by Courtney, is a fictional book that Bebe Moore Campbell walks us through the journey of a mother who is caring for her daughter, who has been diagnosed with bipolar. And with this diagnosis, you begin to see through her lens, but also the cultural lens, if you will, the impact of stigma with bipolar, with illnesses, but also you see through this lens a host of various things, generational, in that when we don't address generational challenges, how it can play out in our life. And so with that, I'm going to go to our next question, where it talks about asks, how do you break the generational stigma associated with BIPOC and the mental health system? And I'm going to take that over to Pastor Byron.
All right, I'm sorry, say that question one more time.
Sure. How do you break the generational stigma associated with BIPOC and the mental health system? So I'll go to you first, and then I'll come back as a mental health person.
Good, good. So one of the things is I think we create space to talk about it, right?
Mhm.
So let's take it back to Carrie for a moment. If you notice, there was this interesting dynamic to where she even made a comment early on in the book to where she could not really even discuss this issue around people who looked like her. So even though it's clear that she had a connection spiritually, she goes to a predominantly white Presbyterian church where there are people who don't look like her in order to talk about it. And that's where she's most comfortable. What we see is that she struggles throughout the entire book with accepting any kind of pain that she's experienced, whether it be what she was dealing with her mother and her mother's battle with alcoholism, right? Or whether it was the death of her own child and how that impacted her first marriage, all these dynamics, all the way up to accepting the entirety of the book until the end. She's hoping that something's going to happen and things will go back to the way they were before bipolar, right? So there's not a space where things were created in environments that were culturally normative for her to be able to begin to unpack and discuss it. One of the things I also took notice as I read the book is I didn't really see a lot of space where she went to therapy herself to begin to work through this and unpack things. I did not see where that was even necessarily recommended as she was going to the peer support groups and with other people going on a journey. So her own acceptance of her own journey and pain was tied to her being able to accept how she needed to walk with her own daughter. So in going back to kind of answering the question, I would say we've got to create spaces where not only is it encouraged and accepted that we can talk about and unpack these things, but we can also dispel the shame that's attached to it, right? That you're not a bad mother because this is the journey that you're on with your child, right? This is not your fault, right? That there's not performance that you can do to get out of this, that you don't have to beat yourself up, right? Like you're in this fear of making her daughter feel the way her mother made her feel, right? She ended up not being able to really care for her daughter well. So all this is playing out, and never did I really see a space where she was able to really be invited to unpack it within a community that looked like her, that knew the dynamics that are at place and in play when you look like her, so that that could emerge. It took 30 something chapters before she got there.
So I realized, thank you for that, Pastor Brian. I realized some of you may not have had the opportunity to read the book. And so I just want to kind of name for you who are some of the persons in the book. So you, as you hear us talk about them, it kind of gives you context. So Carrie is the mom. She is the main character that's walking us through this journey in 72-hour hold. Clyde is her husband that she was married to. He was Carrie was Clyde's first wife. He had 4 marriages, but for the purposes to make it real easy for today's discussion, we're primarily focused on Carrie, the mom. Trina is Carrie and Clyde's daughter. And then Clyde is the biological father of Trina. Trina and Clyde they are divorced. And we also learn of Carrie's boyfriend throughout the book. What I would add to this discussion when we talk about generational, we can talk about generational trauma, generational, as it was mentioned from Pastor Byron, Carrie's mother was an alcoholic and therefore was not able to be, I would say she experienced alcoholism, let me say that. She was not able to be there with Carrie as Carrie had wished. And then we find now we have Carrie who has a daughter, Trina. She's taking her daughter to therapy eventually to get her some assistance. And one of the questions that was asked is basically, how does this relate? So 72-Hour Hold was written in 2005. So how does this relate now? The other is, how can we confront the role of parents' mental health, or rather lack thereof, plays without pathologizing our trauma. And I think I understand what this person was asking, and I'll respond in this way. It is important to know in the book we see here where the physician who was treating Trina said to Carrie, his name was Dr. Ustinov, and he was providing care to Trina. And he said to Carrie, the mother, that basically there may be a genetic predisposition to why she's been diagnosed with bipolar. But what he was trying to do for Carrie was allay. Carrie was looking for a reason. And as an African American woman, historically, and we still see this to this day, there's this concept of the Black woman syndrome, the superwoman syndrome. And Carrie's position was it has to be a reason. She was concerned that everybody was going to blame her. They were not going to blame the father. But she just kept looking for, why is this happening to my daughter? And he attempted to help her understand that that there may be a connection that's to predisposition, but it may be unknown for several reasons. The other question that was asked was exploring mental health and family dynamics. How does 72-Hour Hope portray the impact of mental illness on family relationships? And so here we see around page 30 that although Dr. Ustinov tried to assure Carrie that her daughter Trina's diagnosis was not her fault, she didn't accept it. She began questioning herself, her decisions, the divorce from her husband, Clyde. And so as a result of these questions and the challenges Carrie had with her mother that were not resolved, it plays out in how Carrie provides care for Trina. And so ultimately what's happening is, though she thought in her mind, I'm going to try to be a different parent from my mom, she later, towards the end of the book, and you began to see, she really showed up in a different way, but in the same way as her mother, because she had not resolved and healed from the concerns that she had with her mother. And as a result of that, Trina is able to say, after she's gotten some much needed care towards the end of the book, in the late chapter 30s, she's able to see that, okay, she being caring, that, yeah, maybe I didn't approach this some of the same way. And so you see some forgiveness and healing towards the end of the book. And so I would say that that is still true to this day, that if we do not seek therapy, if we don't seek to speak with someone about the shame, the trauma that has happened in our family system, we will repeat it because we don't have a name for it. We don't know what it is. And subconsciously, those things can happen. I want to go now to a question, and I'm going to come over to you now, Courtney, about what are some of the methods and best practices to support racial and oppressive barriers in assessing mental health systems of care?
Certainly. Well, there's three things that I think help to ground us in addressing some of the navigation channels that we face and experience as minoritized communities. One is we must have a plan on who do I call, first and foremost. Who do I call? Where do I go? We must know where to go for ourselves, for our loved ones. And we must, number three, what do I do? What do I need to physically do, emotionally do, to move to the next space and place? If we can take those three things and infuse that within our communities, in particular the Black community, Pastor, from the pulpit, from the safe spaces, you talked about the workforce, our allies in community really need to be able to have a plan to answer those three questions. And I hope that this discussion inspires some planning, because we don't always know when a situation is going to arise. And the beautiful thing about the book, and Dr. Brooks Davis and Dr. Benton, you both alluded to this, was that resolution came in chapter 30. That was intentional because it's a journey. It wasn't a sprint, it's a marathon, and it was ongoing, right? The book ended, but the story continued. So a couple of things for Black and Brown communities in particular, we really need to have a plan with our pharmacists. We were talking about the workforce shortage, Pastor. Oftentimes we forget our pharmacists. We want to make sure that we have a good plan and a good relationship with our pharmacists. They are often forgotten, but they are some of the most trusted and beloved resources in our community. We can go to them for answers to questions, whether it's medication, how do I use it, help me stay on my therapy. We also need to make sure that the wraparound, our peers, Black peer support, respite places, we need to make sure we're supporting that in community and being able to have allies in other spaces and places, social workers, allied health, our nurses. The continuum of care from psychiatry to psychology has to continue to expand. So there are other supporters who also identify themselves as clinicians in the process of healing, from the pulpit down to the present day on the street, that we need this village to stand with us in support of destigmatizing diagnosis so that we're on the journey to discovery. Our social justice allies, they are our allies in the healing of our communities as well.
Thank you for that. And that's going to take me, we're now preparing to go to see what questions we have of you, those of you who are in attendance. But Ms. Lang is a perfect segue over to some resources that I have dropped in the chat for you, and I'm sharing them now. So one of the things, takeaways, what's your takeaway when you leave this session? We hope one thing that you will do is that you will identify within your village, who can I talk to if I'm experiencing a mental health concern or if a family member? So we want you to get one of those, a care card. So who's my go-to person? Who's my local pharmacist? Who's my primary care physician? Who's my pastor? Who's my faith leader in my community? We want you, from this discussion today, we want you to identify those persons, have that in your wallet. So God forbid, if you are experiencing mental illness and you get in a crisis, someone looks through your wallet to find out who you are. They also have the name and number of places and people that they can call to advocate on your behalf. And guess what? It may not be your blood relative. But it may be someone in community who believes you and is willing to advocate for you. So in the chat, I have dropped one resource. And we're going to send this out to you as well. But one is Mental Health America provides a screening tool. Today's conversation briefly was around bipolar, but they have screening tools that can tell you what are some of the other areas. Remember, it's a tool. It is not a psychological evaluation. It is a tool to help you then be able to speak to a mental health professional about the results of your respective tool that you took on mental health on MHA's website. The other thing is Restoration Center is a resource where I serve as the director. But more than that, Psychology Today, it is nationwide. So that's www.psychologytoday. And you can search by your zip code for a mental health professional or a coach for a number of persons who can come and provide support for you. And then I'm gonna also drop in the chat, when we talk about 72-hour hold, and it was stated earlier, the states are different. There is a website that is Treatment Advocacy Center. You can find by state what it means for you first to get an emergency evaluation, followed by a hold. And depending upon the state, the hold may be 48 hours first, or it could be 72 hours. So again, we'll provide those resources for you in the chat and a follow-up. So now let's go to you, Ms. Zimmerman.
Absolutely. Well, first, thank you, Courtney, Dr. Venton, and Dr. Brooks Davis for answering those first questions that were big ones and a lot to unpack, but really helpful as we kind of dissect this book. The first question I want to bring to you all is someone had asked, do you think that parents in our society struggle with the educational piece of understanding different diagnoses their kids possess and how to parent around those? What are some things that parents can do to increase their knowledge and expand their parenting?
So I will say, So one of the things that's interesting that thank you for your question. One of the things that I have found in over my 20 some years of doing therapy, parents tend to generally bring children to therapy and say, fix my child. When we say parents, we need you to come be a part of that. Oftentimes they're busy. They don't want to be a part, so they don't want to receive the education. What I would say to our parents is that more times than not, it is a systemic issue that needs to be addressed. And so the child is often acting out what's happening in the home. And so we need you as parents to first be willing to humble yourself and not be as Carrie was, which is finding a reason to say, why is this happening? But be open to understanding that there are some things that we don't have the answers to, right? So we may know that there's a predisposition, but we can't pinpoint and say, oh, it's you, it's this, it's that. Not necessary in every situation. So even when coming into therapy, be willing to say that perhaps I'm contributing to what's taking place, but it's possible that I'm not. But either way, we want to know, right? So we can address our specific situation. So I would say first, it's parents being open to hearing. Then once they're open to hearing, we can provide education. So now we can help you understand more about your child, but we also have to be able to explain more about you as the parent, right? So maybe it's some of your parenting practices that we need to provide some education around. So again, come with an open and honest and again vulnerability, right? Because when you as the parent do that in front of your child, you're teaching your child that it is okay. We're going to get through it no matter what it is. And finally, I'll say, if you're not ready to hear the truth, get your own therapist as a parent, right? Get some therapy and support to help you help your child, so that you all can come together and receive the services that you need. I don't know if anybody else has a response to that.
The only thing I would add is that many times we see this not just with children and parents, but also with couples. In order to deal with the root issues, you many times end up having to go on your own healing journey because you don't really realize how that's contributing to the dynamic or how it's hindering you from being able to show up the way that you would need to show up in order to really be present. Because a lot of times we've built a lot of coping around things, and sometimes the way we've been coping may not necessarily be helping us to really address and heal. And so one of the things I often say sometimes in church, within our tradition, when the spirit gets the moving, sometimes we don't know really, is it that healing occurred or did you just get a dopamine hit, from how active things became here? So it's really being able to discern that and to realize that just like Carrie, you may be wanting that with the snap of a finger, you take the child to the therapist and now everything's fixed. But it may be that there's a holistic transformative journey for the system to go through in order for this to really be addressed.
Yeah. I'll say, just chime in that, the book illustrates that parents oftentimes are the best advocates for their children, and children are the best instructors oftentimes for the parent. And I think that was really evident in the book. So I think both of you really hit the nail on the head. And to the extent that we can create safe spaces in schools to be able to provide a platform for that navigation continuum to occur, then we have served the community well.
Absolutely. And I think that community support is such an important piece of this too. The community education, that demystifying stigma, is so important. And that can be done in so many spaces. And I know that this is a little off topic from our book, but I want to bring this question to Dr. Benton because we've had multiple people asking in the chat. And I think it's really essential when we have these conversations about how we can best support children, how we can best support families, that we think about all of the spaces in which we heal, that it's not always just in a doctor's office, that it's not always in therapy. Those are really important pieces of it, but we need support in a lot of areas. And a lot of people have been asking about, Dr. Benton, what you are doing in your faith-based programming, what that looks like, how you've been able to give space to talk about mental health and mental health conditions. So I just love for you to have a minute to really dive into that, what that community support in this unique space looks like.
Yeah, sure. And thank you for that question. And let me just, preface this by saying I don't think we're by any means the model at this. We're trying to figure it out and on the journey like anyone else, but hopefully this will be helpful. What I would say is the first thing that we've done, and that I would encourage anybody to do, the low-hanging fruit, is to just create the space. So what does creating the space look like? One, we have a seminar every year where we bring in Black clinicians who are practicing within the community. We set them up in our gymnasium with tables and we go, hey, you can just come and meet therapists. You just come and meet. Come walk around. They're all types here, etc. Just so that we're beginning to build the relationships there. I mentioned that we have over 30 clinicians within our church. And so we formed, they call it the Body, Mind, Soul Ministry. They do education to all of our leadership so that if the leaders are better informed, if our staff is better informed, then we can hopefully do better. So that's another place where it's low-hanging fruit. They put together a manual that literally is our reference manual for any situation that our leadership has. We have it in PDF and we have 2 copies at the church so that if we're presented with an emergency and we need a referral, we just turn into that book and here's exactly what you need to do. And we do training on that manual. What else do we do? Oh, creating space. Again, when I arrived in North Charleston, I was alarmed that there was not a Black church that held NA, SA, AA, divorce care, what else? Grief share. So all those are things that we've opened up our doors just so that there's a safe space. Because remember, sometimes safety is just about the space. It's about where I'm going. And if the space where I'm going is already one that's viewed as a place of peace, a place of safety, then automatically now I'm disarmed and I can go in there. So it's not about necessarily us having to have the leaders to lead all that. It's about, no, we're just going to open the doors and create the space for somebody else who can do that. The last step, and this is something Dr. Frederica could really speak about more because it's where we're beginning to move into. We have a list of our clinicians to where we're able to refer out. One of the things that we ask our different parishioners, because some of them have a preference of we don't want anybody associated with this church whatsoever. And others say, we definitely want somebody, like, I don't want to go to somebody who's not connected to our church. Now, I should also preface this by saying our church is pretty large. And so you can come to our church and not run into anybody who you don't really want to run into on a Sunday morning. So some of this, if you're a little bit smaller, may be a bit more difficult because we do have clinicians who see people within our church. We don't necessarily know about it or anything, and they can pretty much hang out on opposite sides of the church and never even know that they're really there. But with that said, that's a part of the dynamic. And so we have a list of specific clinicians who are open to seeing people. They're separate and apart of what's involved on Sunday morning, and they basically get referred out to them. So we kind of have this entire model. The end goal is to do what Dr. Frederica Brooks Davis has done up in the DMV area, and that is to actually create a separate center altogether. But she can give comment there. But those are kind of the steps: create space, educate leadership, and then move to build a center. And the one other thing is seminars. We do quite a few seminars on different things and invite people to them. And what's really been most powerful has been the testimonies of our members on their mental health journeys. We record them, we play them during worship service, even during Mental Health Month. We have live testimonials where people talk about being on medication, how it's changed life. Their children have testified. That has been probably the most impactful thing over anything we have done, was people seeing people who they're like, but they're a deacon, they're a minister. I looked up to them like this. And now I see them as human and look up to me more, and I don't feel as bad about what I'm going through because their honesty has set me free. The testimony has set me free. All right, I feel like I spoke way too long there, so let me stop and pass it back.
So
That's
while we're on
yeah,
to
go for it.
Jackie, I'd like to say I have dropped some in the chat. And so I've been reading the chat, some of the comments as well. So let me highlight a couple of those that are in the chat. They'll come out to you by they'll be emailed to you as well. But we have blackpsychiatrist.org is a reference for you. We also have a podcast that featured two of MHA's board members, that being Courtney Lang and also Karis, on her Unapologetically Black Unicorn podcast. And on that particular link that I've added in the chat, it is referencing the conversation around Mr. Ellis Gordon, who was Bebe Moore Campbell's husband. Am I correct, Courtney, in that? Yes. Who is also Courtney's godfather. So please check that out. And then the other one that I will plug here is that we have upcoming, you can participate in person or virtual. Pastor Benton and I have a podcast, which is a pastor and a therapist. And in that space, you have a therapist and a pastor talking about various topics that the church often will not address. But we also have a session, this upcoming podcast, we're going to be working with pastors and church members around church hurt. So back to community and bringing that together. And then there's another session the next day, but we're trying to heal in that way, creating safe space. So check those links out as well. All right, back to you, Jackie.
Perfect. Thank you both. And thank you for your answers on that. I think it's such an important piece of this collective healing, that there's not just one answer to this. It really does take a village. And that we're starting to have these conversations in different places is really important. And I know, Dr. Benton, you've got all these great resources you can refer people out to. If you're someone who's sitting here listening, well, I'm not sure what's available in my area. We have an fantastic national line, 988. I would be remiss if we did not bring it up, but 988 is always available 24 hours that you can send people to if they're experiencing additional stress, a mental health crisis, anything that they're needing to talk through with someone. You can send them to 988, and you can connect with your local health departments, with your local behavioral health clinics. Start to just reach out to members of your community if you're in a place of worship, or you're working in a community center, or in a space that works with youth where you're not quite sure what those resources are. Start to ask those questions to different people and put together kind of that plan that you can refer people out to. Like Dr. Benton said, it's not that you have to house all of those resources yourselves. It's wonderful that we have churches that are starting to have that ability. But if you don't have that ability, just being able to connect and really just open the conversation so that people know this is a safe place where I can talk about this with someone. So thank you. Moving to another question from someone that had asked in the chat, what advice would you give to parents on how to navigate this area with a young adult child who refuses treatment or outside help? This can be a really challenging space to be in.
It really can be. And so, again, this is important to find out if your state has mental health courts, but even down to your county, right? And finding out what the resources are and educating yourselves around the terms in that regard. We have had, in my experience over the years, parents of young adults, and it's becoming, as the years go on, this is becoming a greater issue as young adults are returning home to live with parents. And so one of the things that I can say here I'm in Prince George's County, located in Maryland, that it's extremely difficult because unless the young adult shows themselves to be harming a self or someone else, even though depending upon the county, we can reach out to 911 or some of the other resources. Sometimes it can be a challenge for parents to forced to help, if you will, if someone is not currently active in a state that will allow for them to get an evaluation and then a hold. In that particular instance, what I do recommend to parents always is that if you know your child is experiencing a mental illness, and this is a mental illness that often causes them to have mania, I often encourage parents to contact the local police department. And why do I say that? Because not oftentimes, sometimes law enforcement, just like anyone else, can confuse mental illness with being aggressive, right? Aggressive in a way that's going to be harmful. So if we place our local law enforcement on notice that my child has a mental health concern, they are not currently being treated, but I want you to make you aware of who they are, where they live, so that if law enforcement interfaces with your loved one, if they run the tag, there's a note on there that states this person has a mental health concern, and they can approach them in that way. But also it may save a life, right? So I do encourage you to do that. Again, because we don't know where you're from, we can't offer legal advice in terms of how you handle it. But number one, find out what is the law in your respective state. Also find out about mental health court, advocate there. If they will not be seen by a therapist, or they're refusing to go to the ER, contact your local, even if they are, I would still contact your local police department and make them aware.
Frederica, I may just jump into, just to piggyback off of what you said on page 123 in the book, there is a reference to SMART teams, which are system-wide mental health assessment response teams, like a crisis intervention team, but even for non-crisis situations, that some of the county public health departments have these mobilization units just to help to do safe assessments and triage. So that's just another kind of good resource that was referenced in the book that may be available. It's not universally available, but may be available in local areas. And just don't forget our beloved pharmacists, who oftentimes can actually help and aid and support psychiatric transitions in care, in settings of care.
Yeah, and so what Courtney is talking about, our crisis response teams, every state, every county, it varies. So one of the things you do want to do is to find out for your county, one, if there is a crisis response team, and two, if it's mobilization, three, their connection to your local ER, or if there's a psychiatric union, because it's not equal across the board. And some of them, you can call them, but they will do more triage over the phone. Some of them will actually come to your location. Others will come along with the police. So that is a great reference point, but contact your local health department, your local county, to find out what the resources are and what they will and won't do. And then let me also say, because we're talking about stigma, I've encountered parents who come to us, talk to us about it, but they, because of stigma, they don't want the police showing up at their home. And so it's even in the book, we see where Carrie was saying the same about her windows, when Trina broke her windows and things of that nature, of being concerned about the people in the lawn service people knowing. So again, but if your person is acting out, at some point we have to say it's life or death. And it's not even just the life and death of the person who has the mental illness, it's also your life and death. And that's what I like to talk to parents and loved ones about too, because if a person is inactive mania, they may not be at a place where they can recognize and distinguish. So we have to think beyond just the patient, the individual, but also the family and community at large.
If I could just add one quick thing, one of the pieces that I think we found with Carrie also was, once she was able to get with a group of people who really relate to her journey because they've been there or are there, that kind of interaction was very helpful in finding out what other resources and things are out there. So I would encourage, if there are groups available in your area, support groups for people just like you. I also noticed we experienced the same situation with individuals who are caregiving for elderly people who are experiencing dementia or Alzheimer's, things of that nature. At one point, we were even offering a respite during church in partnership with a nonprofit, so that people could bring who they're giving caregiving to and put them in the respite so that they could attend worship, things of that nature. Exploring what nonprofits, what other organizations, things that are out there so that you can really come together. A lot of times there's resources you don't know about that are right around the corner. And as you begin to rub elbows with others who are on the journey, you begin to find that out.
Absolutely. Thank you each for your insights on that. It's really helpful. I know this hour has absolutely flown by and we're almost at the end of our time. I want to give a huge thank you to Courtney, Dr. Benton, Dr. Brooks Davis for being here, for sharing this space with us, and really to all of you for reading the book, participating, asking such great questions, continuing on this legacy of Bebe Moore Campbell. So to close out, I'd love to hand it over to Courtney for a message.
Thank you so much. Just gratitude to the entire staff, leadership team, and board of directors for Mental Health America for supporting this particular activity. To Dr. Brooks Davis, who was fearless in her advocacy to ensure that this session occurred. We owe her all praise right now. And of course, as was stated, Dr. Benton, but special thank you to Schroeder Shribling, our president and CEO for Mental Health America, for her leadership and support. We're going to close with words that Bebe Moore Campbell would always close with, and her final acknowledgement in the book, 72-Hour Hold. Ring the bells that still can ring. Forget your perfect offering. There is a crack in everything. That's how the light gets in. That is the epigraph, Leonard Cohen anthem. Her final acknowledgements for 72-Hour Hold. And for all the faithful ones, courageous enough to believe that hard times can make way for good outcomes and even happy endings. May God bless you. Thank you so much.
Thank you for that, Courtney. We open in the words of Bebe, and now we close. Thank all of you. Thank you, Jackie, for hanging in there with us and helping us to make this possible. Thank you.
Thank you, everyone. We will be closing out, but don't worry, we will send out the recording to everyone within 1 week, and that will also include all of the resources shared today. So thank you again for your fantastic questions, your engagement, and we hope to see you at one of our upcoming MHA webinars again soon. Thank you all.